Senator Cameron.
Mr. Chairman, I want to be just brief. First of all, under Rule 39 of the Senate, I would like to disclose that I'm an insurance agent and could be perceived as potentially having a conflict.
Put it in the journal, Senator.
Thank you, Mr. President and Senators. I appreciate the debate that's been given here this morning and the points that have been made. I do want to touch on a couple points, and I will not try and go over everything because I think as the good lady from a good senator from 26 said in her debate, we all have our perspective, and no matter what your perspective is, it's probably right. And we're not, as the good senator from 3 said, we're not going to change anybody's mind here today. But I want to talk from my perspective, and I do want to answer a couple of the questions that have been raised, or at least try and put my perspective on the answer of those questions. First of all, I agree with the good senator from 32. We are not debating the Affordable Care Act. We are not debating those 700 pages. That would be a real easy vote. I wish they would give that authority to us. I wish we'd have that opportunity, but that's not what we have. I know there's some confusion about the cost. Both the good senator from 22 and the good senator from 3 mentioned the cost. The dilemma is not knowing how many people will participate. And the Senator Thane mentioned that a little bit in Senator from 8, and I'll talk about that here in just a second as to try and put some parameters on that. It was brought up by my good friend from 22, concerns about privacy. Let me talk about privacy just for a second. All of the provisions of this act are covered under HIPAA. All of the provisions of any application are covered under HIPAA. Currently, as the good senator from 3 knows, and the senator from 4 and I know, you fill out a 4-page application, you disclose everything in your medical history to an insurance company. Under the new program, that's not going to be the way it will be. You won't disclose any medical information. You'll disclose your name, you'll disclose your Social Security number, and if you want to apply for a tax credit, you will have to share income. Now, all of that will be, again, protected by HIPAA. Nothing in this bill or nothing in an Idaho exchange requires you or your constituents or their families to go to the exchange. That's one of the benefits of doing a state exchange is it's completely, utterly voluntary. The carriers are voluntary, those that wish to participate in it, and those that wish to purchase through it are voluntary. You've heard me say on the floor, I don't really believe I have a conflict because I believe any exchange will cause my business to lose money. I believe that a federal exchange will put my business out of business. A state exchange gives me a fighting chance because under a state exchange I have an opportunity to work with the exchange, whereas under a federal exchange, at least the way the initial act was written, and I have read most of it, but not all of it, and at least the way the initial rules were implemented, is that if you wanted to buy insurance through a federal exchange, you would go to a navigator. A navigator may not be a licensed agent. It may be somebody completely unrelated. The good senator from 7 brought up a couple of points, and I just want to touch on a couple of them. First of all, I got to reiterate again, no one is required to purchase through the exchange. You don't want to go to the exchange? Don't go to the exchange. By the way, that's the difficulty in determining the cost is we have no idea how many people will utilize it. I stand with the senator from 7 and the senator from 22 and the senator from 30 and others on trying to fight for our religious liberties and trying to protect the rights of the unborn. I feel that's very critical. I had distributed an email I received last Monday, or earlier this week on Monday, from the Catholic Charities of Idaho, and I like them find that we are better off with a state exchange. Let me tell you why I believe that. There's no question that Idaho has done everything we can do to protect the rights of the unborn. Everybody says that. But everybody will quickly say, but that's the same whether it be a state exchange or a federal exchange. There's no question that there is controversy around abortifacients and around Ella and Plan B and whether they would be required to be covered. But everybody will quickly say both of them would be treated the same under a federal exchange and a state exchange. Here's where I think we have more at risk by going to a federal exchange when it comes to the issue of termination of a pregnancy or comes to the issue of abortifacients. Under a federal exchange, somebody once said in a previous debate that there's no way the federal government can implement 26 different exchanges in 26 different states or in all the states. That's not how this is going to work. That's not how this will be operated. The federal government is already developing their exchange, and if we don't have one, you just have a link to that exchange, and that link will be there. The good senator from 31 sent me an email a couple weeks ago that had a link to a federal exchange, and he had followed it partly way through, and so I followed it all the way through. I had my son and new grandson were looking for coverage, so I plugged their names in and their ages, and we followed it on through. By the time we got to the end, we had 2 companies. 31 plans, but 2 companies. That's the only ones they were showing. Regions Blue Shield and Pacific Source. One non-for-profit carrier, one for-profit carrier, which, by the way, is what the Federal Act says it will do. But you might be interested is along the sides, much like you would if you were on Amazon.com or any of the others, you had links that you could click that would tone down the choices, if you will, or would focus your choices. One of those links, as I recall, was pre-termination of pregnancy. One of those links was same-sex marriage. Under a federal exchange, even though the state of Idaho will have prohibited that, you will be, if your constituents will link to whatever federal exchange in whatever state it is, and then they will be able to pick and choose as they go through. They may end up with a United Healthcare or an Aetna plan or whoever else, and they're good companies. I'm not going to stand here and demean the companies. They're good companies, but they are domiciled in states that may have mandates that require coverage of certain things that we find offensive and that we find would be wrong. The senator from 9 asked, I thought, was a really good question and part of some of the misinformation that's out there. He asked about noncompliance. The Act requires and the law requires that the exchange certify that the plans sold in the exchange meet the requirements. There's no noncompliance of individuals participating. You can choose to participate today and not tomorrow. You have that ability. There would be no non-notification of your individual constituents. It would simply be, is the carrier that's participating in the exchange offering compliant products? Is the carrier participating in the exchange playing fairly, operating fairly? There's been some question about the subsidy and the tax credits, and the senator from 7 mentioned a quote. I would just politely and gently suggest you get the whole report because the quote is sort of taken out of context, and I've seen it, and I'm not blaming the senator from 7 because frankly it's being bandied about by others who were opposed, and it refers to the standard by which they go through to determine how it would be handled. And so it points out that the first reading, one might believe, and uses the quote that the good son from 7 used, but then later goes on to point out how the other standards, and there's this two-step process, and how the Supreme Court has ruled based on those other standards. And its conclusion is that the Act falls under both of those standards, that there is no question that the tax credits apply to both a state exchange and a federal exchange, that there's no question that any penalties that would be imposed will not be imposed by the state exchange, but be imposed by the IRS, by the authority provided in the Act to the IRS. Now, some would argue that they don't have that appropriate authority. And I don't want to get into the weeds whether they do or they don't. I'm just pointing out for you that the same research cited on this floor as reasons not to actually, if you read the entire thing, says that you should. Now, the senator from 2, and he's left, but he talked about what are the reasons, what do we gain? I mean, he talked about a number of things, and I made a number of notes, but you know, and whether we're giving up or not. I believe we are not. I believe this is an opportunity for us to push back. I believe it is our opportunity to put our stake in the ground, draw our line in the sand, our ability to say this is how Idaho would do it. Frankly, much the same as what Utah has done in the past, although they're now they drew the line and then they backed up and they've drawn a deeper line, but they're still doing part of that. But a wise man once said to me that diplomacy is the act of backing up while looking for a bigger stick. And perhaps in a way that's what we're doing here, is that we're approaching this in a way that we're able to pick up a bigger stick. Here's what I think you gain with a state-based exchange. First of all, you allow a voluntary participation. All Idahoans will have the opportunity. You allow all Idaho carriers to participate. You've heard me say it before, under a federal exchange, the law says one non-for-profit, one for-profit. Now, subsequent HHS memorandums have said, we'll allow other carriers to participate, but we don't know at what the cost. Will they allow every carrier to participate? It's doubtful. In an Idaho exchange, every carrier who is licensed in Idaho, who wishes to meet Idaho law that we all pass, would be eligible to participate. One of the benefits, and we talked just briefly about it, and the senator from 8 brought it up when he talked about health care costs. He's right on health care costs. Those are some of the things that we need to do. But let me tell you how the exchange, if this wasn't tied to the Affordable Care Act, we'd be having a debate about how the exchange actually can help employers save money, and how the exchange can actually help people make appropriate decisions with their health care dollars. That's one of the major benefits. This was frankly, a Republican idea endorsed by the Heritage Foundation, endorsed by ALEC, until it got tied in as part of the Affordable Care Act. I just, to my friend from 3, I thought you looked pretty good, actually. And even in gray, I didn't notice that it was gray, but I thought you looked good. And I know that this is tough. And you and I look at it differently, but we have the same perspective. I frankly don't fault the companies for trying to build up reserves, knowing that the Affordable Care Act's implementation is coming forward, and knowing that from once that's fully implemented, the choices that they have to make become much more restrictive, and knowing that if we defaulted to a federal exchange, perhaps we wouldn't have built up the reserves quite as much had we made the choice a year ago or so to go to a state-based exchange. But knowing that we may default to a federal exchange, they got to have some mechanism. If they have to show that they're the biggest dog in town, they got to be able to show that. They got to show that they got the most customers, the most reserves, etc., in order for them to play in that federal exchange. I don't fault them for that. The senator from 18 talked about consumer protections. I want to promise you, Senator from 18, that the consumer is much better protected under a state-based exchange than a federal exchange, that the consumer has a seat at the table, an Idaho consumer, not a consumer from New Jersey or Wisconsin or Massachusetts, but an Idaho consumer has a much better seat at the table. And I want to commit to you that I believe that the fees charged inside the exchange, there's a direct incentive for them to be pushed down. The dilemma is, as mentioned with the Senator from 28, we can all guess as to, he's got his theory as to how many people will participate. I can tell you in the high-risk pool, which is largely guarded as one of the most successful pools in the nation, after 10 years, we're barely hitting 10,000 participants. That's not total enrollment. That's participants ever. So some would come in, left. So we have no idea. That may be, and initially people may not choose to go there. Frankly, I hope they don't. I hope they come, and talk to their local agent. But they could, and they may find it as a useful tool. I think there's an incentive in the program in order to help hold the cost down. Now, lastly, the senator from 30 talked about the comment made by the state treasurer. I want to thank him for debating as long as he did, because it allowed us to check that. So, and in conversation with the state treasurer, I'm told that he said that the Moody's said it was just a routine inquiry, that there was nothing negative, nothing more to it than that there's no contingent liability. And frankly, I can see the argument, but I could also argue that there's a potential contingent liability and a contingent loss of revenue to the state as businesses are hurt under a federal exchange versus a state exchange. But I'm told that and frankly, Moody's has given us the highest rating, as has Fitch's, as has Standard & Poor's. I've had the opportunity to be on some of those discussions with them. The senator from 30 also talked about the 26 other states. I had handed out a map, and it has on one page, and some of you have it double printed, and I'm sorry for that. It shows my inadequacy in running a copy machine instead of handing somebody else. But the first page of that shows how many states are doing state-based exchanges, and how many of them are doing partnerships, and how many are doing federal. Do you want to guess how many of those states are in communication with Health and Human Services, even those that have said they're going to a federal? The answer is all of them. Do you want to guess how many of them are still talking about behind the scenes doing a state-based exchange? The answer is all of them. Many of the other states have chosen, and I don't want to imply their motives necessarily as to why they've chosen to go the federal route, but the reason for the page 2 is to show how many of the states are also looking at expanding Medicaid. It's rather interesting to see a state saying no to exchange, and then on the other hand saying yes to taking Medicaid. Out of the 26, I think there's something like 8 or 9 that are saying yes to Medicaid. Many of those states, by the way, that are saying no are doing so. They were never part of the original lawsuit. There's actually another graph that shows which ones were participants, as Idaho was in the lawsuit, and most of those states weren't. I do want to touch on, and I mentioned before, the issue of mandates, and that's part of the reason. You might be surprised to know that every single state of those 26 states, their costs are higher than Idaho's. Every single one of them. Every single one of them have higher mandates, and they cover a wider range of products and services. Every single one of them have more mandates. Most of them at least twice as many, some 3 times, pushing 4 times as many mandates. We have a total of 7 mandates in our state. Most of the other states have at least 14 to 25 mandates. Mr. President and Senators, I, like most of you, don't believe the vote's going to change necessarily that much, but I'd urge you, this is a step forward to, it's not just words on a paper. This is a step forward to protect Idaho citizens, Idaho consumers, to protect Idaho jobs, to protect our rights as Idaho citizens so that we don't acquiesce to the federal government and allow them to come in and run it the way they would without our input. Thank you, Mr. President.
The debate